DSM-IV, Dementia and Other Cognitive Disorders by Karen Koba. Delirium. Definition is a rapidly developing and fluctuating state of reduced awareness. It's characterized by trouble with focus and attention. It has at least one of the following: defect of memory, orientation, agitation, perception, or disruption of language. Causes. From the medical, they are brain trauma, infections, epilepsy, medication toxicity, poisons, and other diseases. Substance-induced use of alcohol, such as Korsakoff syndrome, sedative drugs, illegal drugs, and medications. Other etiologies. Causes can be from one or more contributing factors. Symptoms. Senses may dull, may alternate between moments of confusion to periods of being rational and clear. They worsen at night, sundowning. Speech is confused, not coherent. Difference between dementia and delirium. They are not always easy to recognize. Delirium can be resolved, dementia cannot. Dementia. Definition is a deterioration of the mental processes, usually characterized by memory loss, personality change, and impaired judgment and ability to think abstractly or systematically. Dementia may be caused by physiological changes, the result of stroke, Alzheimer's disease, substance abuse, medical conditions, or multiple etiologies. Definition from the Social Work Dictionary. Terminologies that are involved with dementia are aphasia, apraxia, and agnosia. The apraxia referring to losing the expression of language. Apraxia referring to the ability with verbal and when they cannot say what they want, or the physical part where they desire to move but cannot move the way they want. And agnosia, or loss, and ability to recognize of objects, people, and sounds. The causes are many. Nature is gradual deterioration of brain functioning. Multiple medical and neurological disorders, Alzheimer's disease, Lewy bodies dementia, Pick's disease, and there are others for examples. The genetic components are all that Alzheimer's disease is located on chromosome 21, and a polyprotein, the gene is located on chromosome 19. And these have been found in family genetics. This is a list of many other dementia-related disorders. There are many that hit from young to old, from AIDS to vitamin deficiencies. DSM-IV classification of dementia. First is Alzheimer's dementia, vascular dementia, dementia from other general medical conditions, substance-induced dementia, dementia due to multiple etiologies, and the dementia not specified. Amnestic and other cognitive disorders. Definition is loss of short-term events and recent recall, characterized by types: retrograde amnesia and anterograde amnesia. Causes: biological, as in less blood flow to the brain, the substance intoxication, as Korsakoff's syndrome, high fever, and vitamin deficiency, B1 thiamine. Genetic is the family history of dementia. Others would include head injury, trauma, surgery, substance abuse. The stages, severity, and symptoms. There are 7 stages that go from no impairment to very severe decline. Debilitation based on early onset Alzheimer's or later stage dementia. Symptoms that are behavioral, memory, reactions, being combative, communication, loss of coordination, loss of understanding. Changes in emotional responsiveness and personality. The symptoms. With mood, there's anger, depression, despair, anxiety, and suspicion. Treatment and management. At present, there is no cure, treatment only in place to manage and slow the process. Diagnoses such as Parkinson's or Lewy body may require antipsychotics for delirium and hallucinations. A residential treatment program, along with the use of medications and care in the environment, work to lessen the emotional pain of those with impairment. Other concerns: pain, falls, pressure sores, dehydration, suppressed appetite, constipation, dental changes, vision, and hearing problems. Management also is a large part of family caregivers as they continue to care for their loved ones in the home. Medications and side effects. Prescriptions include sedatives for sleep disturbances and anxiety. Prescription overuse or forgetting to use for other health issues can be a problem. Over-the-counter drugs for common daily maladies. Behavioral prescriptions. Side effects can be attributed to a prescription or lack of use of one. Other effects of aging can also play into these as the brain atrophies, muscle weakness, tremors, and unexplained pain. The history. Alzheimer's disease was first found in 1906. A woman with memory loss and some strange behaviors was being examined. The continued examination happened after her death, and this doctor did a brain autopsy and found the shrunken areas and clumps of plaque in her brain. This doctor was Alois Alzheimer. The organic brain syndrome, this term refers to physical disorders, not psychiatric in origin, that impair mental functions. Prior to understanding cognitive impairment of functions, it was referred to as senile dementia. It was believed that this was a normal part of aging. Delirium goes back to 16th century history. 19th century, the concept was called disordered consciousness and confusion. Not until the 20th century was a full recovery found for delirium. Work of Engel Romano recognized the syndrome was due to reduction in brain metabolic rate and slowing the EEG background activity. Statistics and facts. 16 million people are currently living with cognitive impairment. Baby boomer numbers expected to increase this number. 5.1 million Americans aged 65 and on up may currently have Alzheimer's. This number expected to increase to 13.2 million by 2050. Greater cost of hospitalizations for those with dementia-related diseases. In 2010, we had 647 million in expenditures per state for nursing care facilities. This did not include home and community-based care or the cost of prescriptions. Gender in statistics is more women than men are diagnosed with dementia. Yet our longevity of females over males contributes to the rise of these numbers. Current research. Cognitive disorders and dementia are not natural part of aging. Identifying that the diminishing capacity is specific to disease. must be recognized for treatment of the whole person. Evaluation must be made of what is manageable and curable. Studies are commonly being done with small groups and families that have predominance in these. Research is being done on stroke victims for an understanding of vascular dementia and the connection of obesity, diet, hypertension, and heart disease. Neurotransmitters and abnormal brain cells have been studied with looking into generating healthy brain cells and transplanting them in unhealthy tissue. Drug studies have been done with no success, but the temporary improvement of cognitive functions, but still continued loss. Studies do compare healthy lifestyles, diet, exercise, non-smoking, low alcohol intake, in decreasing the risk in cognitive impairment. Cultural aspects, Black African American. This group is very family-oriented, more care by close and extended families. They have a high respect for elders, with more generations living together in the same homes. Long-term care is the last choice for a family. They have a higher rate of many diseases, including Alzheimer's disease. Hispanic Latino families, the families are the main caregivers, and extended family, friends are support. Elders provide wisdom to the family. A cognitive disorder is attributed to el mal de ojo, the evil eye, or nervios, referring to the nerves. Cultural aspects of Asian, Pacific Islanders, Vietnamese, and Korean. Family is the foundation of daily living. Elders highly respected and obeyed. Belief is that long-term care is shameful. Older tradition of care is put on the eldest son to be care provider. Strong pride. This group would not ask for help. Native American. Elders are respected for wisdom, experience, and knowledge. Traditional medical beliefs still practiced. Tribal decisions may be made on the well-being. They shy away from social services and outside provisions of long-term care. Cultural aspects. European Americans, families that have assimilated to one way of life and function with the changing norms. These families are more universal, not living together in the same community. Respect and values change by which region of country is resided in. Agricultural communities have more caregiving, more close-knit family operations. Metropolitan areas are more reliant on systems of care. Changes with the DSM-IV. Amnesia and dementia have an overlap in the DSM-III, DSM-IIIR, and DSM-IV, and these have not been clearly defined neurologically or neuropsychologically. These have been reorganized, and the term organic will no longer be used. The word dementia had a negative connotation and was eliminated and replaced with major or minor neurocognitive disorder. Because of its reference, usually for elders, it left out the significance of those younger with HIV dementia. Bibliography page.